In recent months, China has experienced a significant increase in respiratory illnesses, particularly among children, leading to overcrowded hospitals in regions such as Hunan Province. This surge has drawn comparisons to the early days of the COVID-19 pandemic. Welcome to the Echoes of Governance, where we dive deep into the intricate world of politics, policies, and power. Here, we explore the reverberations of decisions made by governments, from historical legacies to contemporary shifts. Through in-depth analysis, thought-provoking discussions, and diverse viewpoints, we aim to uncover how governance shapes societies, impacts daily lives, and drives global change. Join us as we amplify the voices, ideas, and forces that echo through the corridors of power, and explore the political stories that matter most. Identified causes. Chinese health authorities have attributed this rise to common respiratory pathogens, including human metapneumovirus (HMPV), a virus causing flu-like symptoms, which can lead to severe respiratory issues, especially in young children, the elderly, and those with compromised immune systems. Influenza. Approximately 30% of recent respiratory illness tests in China have returned positive for influenza. Mycoplasma pneumoniae, a bacterial infection known to cause respiratory infections, particularly in children. Symptoms. The symptoms associated with these infections are similar and include fever, cough, nasal congestion, fatigue. In severe cases, especially among vulnerable populations, these infections can progress to bronchitis or pneumonia. Treatment and cure. Currently, there are no specific antiviral treatments or vaccines for HMPV. Management focuses on alleviating symptoms, such as fever and cough, and providing supportive care in severe cases. For bacterial infections like Mycoplasma pneumoniae, antibiotics are effective. Influenza can be treated with antiviral medications, and vaccines are available for prevention. Potential global impact. If these respiratory illnesses spread to multiple countries, the potential impacts could include healthcare system strain. A surge in cases could overwhelm hospitals and healthcare facilities, particularly pediatric departments. Increased morbidity and mortality. Vulnerable populations, such as young children and the elderly, may experience higher rates of severe illness and death. Economic disruption. Widespread illness can lead to workforce shortages and decreased productivity. Public health challenges. The simultaneous circulation of multiple respiratory pathogens could complicate diagnosis, treatment, and containment efforts. Preventive measures. To mitigate the spread and impact of these respiratory illnesses, public health authorities recommend vaccination. Ensuring vaccination against influenza and other preventable diseases. Hygiene practices. Regular hand-washing, wearing masks in crowded places, and maintaining respiratory hygiene. Avoiding crowded places, especially during peak respiratory illness seasons. Seeking medical attention. Early consultation with healthcare providers if symptoms develop. It's essential for global health organizations and governments to monitor the situation closely, promote preventive measures, and ensure healthcare systems are prepared to handle potential outbreaks. Human metapneumovirus (HMPV) is a respiratory virus that has recently caused a surge in infections in China, particularly affecting children and leading to overcrowded hospitals. Symptoms: HMPV typically presents with symptoms similar to the common cold or flu, including cough, fever, nasal congestion, shortness of breath, fatigue. In severe cases, especially among young children, the elderly, and individuals with weakened immune systems, it can lead to complications such as bronchitis or pneumonia. Transmission: HMPV spreads through respiratory droplets when an infected person coughs or sneezes, and through direct contact with contaminated surfaces. Treatment: currently, there is no specific antiviral treatment or vaccine for HMPV. Management focuses on relieving symptoms, rest and hydration, over-the-counter medications to alleviate fever and pain. Hospitalization: in severe cases requiring oxygen therapy or supportive care, preventive measures include practicing good hygiene. Pain: hospitalization: in severe cases requiring oxygen therapy or supportive care, preventive measures include practicing good hygiene, such as regular hand-washing, avoiding close contact with infected individuals, and wearing masks in crowded places. Global impact: the recent outbreak in China has raised concerns due to the strain on healthcare systems, with reports of overwhelmed hospitals and increased respiratory infections among children. While HMPV is not new and has been known to cause respiratory illnesses worldwide, the current surge highlights the need for vigilance, especially during the winter months when respiratory infections are more prevalent. Neighboring countries are monitoring the situation closely, but experts suggest that the risk of a pandemic similar to COVID-19 is low. The recent surge in respiratory illnesses in China, particularly among children, has been linked to multiple pathogens, including human metapneumovirus (HMPV), influenza A, Mycoplasma pneumoniae, and COVID-19. Current situation: hospital overcrowding. Hospitals, especially pediatric departments, are experiencing a significant influx of patients presenting with respiratory symptoms. Unverified reports suggest that some crematoriums and funeral homes are overwhelmed, indicating a potential increase in fatalities. Government response: Chinese health authorities have initiated a monitoring system for pneumonia of unknown origin to better manage and respond to such outbreaks. Preventive measures: to mitigate the spread of these respiratory illnesses, consider the following steps. Vaccination: ensure vaccinations for preventable diseases like influenza are up to date. Hygiene practices: regular hand-washing, wearing masks in crowded places, and maintaining respiratory hygiene are crucial. Avoiding crowded places, especially during peak respiratory illness seasons. Seeking medical attention: early consultation with healthcare providers if symptoms develop. Global perspective: while the situation is currently concentrated in China, the interconnected nature of global travel and commerce necessitates vigilance worldwide. Neighboring countries are monitoring the situation closely but advise against panic. Dear viewers, remember to subscribe to our YouTube channel for more updated information that echoes around. Drop your comment below. Until next time.